Hi, have you been told you need spine surgery? Need spine surgery? Maybe you do, maybe you don't. Let's kind of figure this out. Let's decipher this. I'm going to help you with this. So if you're a patient with an appendicitis and you're seen in an emergency room, and I'm going to be the ER doctor with the bright orange shirt, I can come in and I can tell you morally and ethically that you need an appendectomy. Air quotes. I don't like air quotes. I don't do air quotes. You need an appendectomy. And you can say you need one because if you don't have one, you might die. That's a potential consequence of having an appendicitis, which is an inflammation of the appendix. But so many people are told they need spine surgery. Do they really need spine surgery? Let's talk about actual need for spine surgery. People who need spine surgery are going to be those who have a tumor, an infection, severe scoliosis, a neurological dysfunction due to a spine problem, such as loss of bowel or bladder control, or a weak or numb leg, or perhaps a condition known as a foot drop. Those people all need surgery potentially. However, that's very rare. That's not the majority of people that end up having spine surgery. The majority of people who end up having spine surgery are people that are having it for pain. And spine surgery should be reserved for those patients when pain is the indication, as an absolute last resort, when all other minimally invasive options have been exhausted. The great news is that there are so many minimally invasive options that can be done for spine-mediated pain. What does that mean when I say spine-mediated pain? So the spine is your back, and really the spine goes all the way from your neck all the way down to your tailbone, known as the coccyx. So anywhere along that course where you're having pain that's generating from any of those levels, we call it spine-mediated pain. As an interventional pain management specialist, I specialize in the diagnosis and the minimally invasive treatment of this type of pain. So how fantastic to get a treatment that does not involve a surgery, does not involve sutures, does not involve incisions. The majority of my patients do extremely well with minimally invasive procedures without opioids, which are also known as narcotics, and their quality of life can be tremendously improved. I always remind people that when we're treating disorders that cause pain, more times than not, it's a marathon, not a sprint. It's not something where we snap our fingers and everything is better tomorrow, but usually patients do well over time with an appropriate treatment plan, again, minimally invasive, that does not interfere with the ability for them to enjoy their life, and most of the time doesn't require any type of significant downtime. So if you've been told you need spine surgery, evaluate whether or not you really need it and whether you would benefit from it. That being said, I work very closely with many spine surgeons, and I rely heavily on my spine surgery colleagues for my patients who do need spine surgery. And there's a lot of really wonderful surgeons out there that do an amazing job treating patients who actually need the surgery. But I encourage you to think about your problem, consult with an interventional pain management physician, and see if there's things that are minimally invasive from a treatment standpoint that can be done for you to improve your quality of life before you consider delving into something more significant, like a more majorly invasive surgery that requires more downtime and may or may not ultimately treat the pain issue that you're having.